This is the third in a series of presentations on radiography of joint disorders in veterinary patients. This presentation is to provide a high-level overview of osteochondrosis and its manifestations in the patients you may encounter in your veterinary practice. By the end of the presentation, you should be able to list the specific sites of osteochondrosis and osseous cyst-like lesions in the dog and horse, and also be able to describe and identify the basic radiographic findings. Future presentations will look at specific joints in the dog and the horse and look at specific findings for osteochondrosis and osseous cyst-like lesions in those joints. In brief, osteochondrosis, or OC, is a failure of normal endochondral ossification resulting in a region of thickened epiphyseal cartilage, or that is the articular cartilage. It occurs in growing and developing animals, and we will talk about it in the dog and the horse, but you should be aware that it also affects the pig and the cow. It will affect typically the large and fast-growing breeds. This abnormal region of epiphyseal cartilage may necrose or die off, can develop little microfissures, and then ultimately, because of that, it can form a cartilage flap or a chondral or osteochondral fragment. And then once that flap or fragment form, the disorder will be termed osteochondrosis dissecans, or OCD. We're going to talk now about the specific joints and sites that you can find osteochondrosis and osseous cyst-like lesions. And it is really important, and in fact, I think you should consider committing this to memory because when you are looking at your radiographs, if you know where to look for specific diseases, then you're going to be more likely to be able to identify them and then come to the correct diagnosis for the cause of the patient's clinical signs. In the dog, osteochondrosis will affect the shoulder, specifically the humeral head, the elbow, specifically the humeral condyle, the tarsus, specifically the trochlear tali or the trochlear ridges, and the stifle, or specifically the femoral condyles. Some other disorders that are probably a form of osteochondrosis include the underlying causes of elbow dysplasia, medial coronoid process disease, and ununited anchial process, and then also a disorder known as ununited medial humeral epicondyle, and that isn't very common, and so we're not going to come back and talk about that. Osteochondrosis in the horse affects the tarsus both at the tibial cochlea, or the distal aspect of the tibia, and the talus in several different sites. Will affect the stifle, specifically the femoral trochlea or trochlear ridges, and will affect the fetlock, and specifically this is the condyle or the distal part of the third metacarpal or metatarsal bone. The horse also forms osseous cyst-like lesions, which are potentially a part of the osteochondrosis syndrome, which is why we're going to talk about them in our presentations. And they very specifically and commonly affect the femur, specifically the medial femoral condyle, and then they can also be found in the elbow, the carpus, and the tarsus, sometimes in the larger bones, and sometimes in the carpal and tarsal kind of cuboidal bones. And then we're also later going to talk about a process called incomplete ossification of the carpal or tarsal bones, also known as cuboidal bone disease, which many people think is part of the osteochondrosis kind of syndrome or complex. Let's just talk about general findings that we might see in osteochondrosis. Those radiographic findings may include several different things, and very importantly, because it affects the articular cartilage, the epiphyseal cartilage, we're really going to look for defects or alterations in the contour of the surface, which is really our subchondral bone. But when we have a thickened part of the cartilage, the bone doesn't ossify, and so then you'll have a defect in the subchondral bone. So this is a horse stifle. This is a caudolateral craniomedial view. And if we look at this lateral ridge of the femoral trochlea, we can see kind of this irregularity of the articular contour. So it's not a nice smooth margin like this medial femoral condyle. We can also see subchondral lucencies. So these are these kind of radiolucencies that would really be kind of geographic regions of lysis, so non-aggressive looking areas of lucency. Then surrounding those lucencies, we can actually see sclerosis, or remember, increased opacity of the bone. So we can have subchondral sclerosis. And then depending upon the joint and the species, we oftentimes will see these discrete osteochondral fragments or ossified bodies. Another term that we used earlier that was non-specific was joint mouse. So this patient has several of these joint mice or discrete osteochondral fragments. And then depending upon the joint, oftentimes they will develop secondary degenerative joint disease. So you can look for the osteophyte production that we saw in our presentation on degenerative joint disease. This is just an same patient here, that same slide without the labeling on it, and then with some shading so that you can see the findings that we just talked about. Here's an example of a lateral view of a shoulder in a dog. And again, we're looking for things like this defect in the contour of this articular surface of the humeral head. There's a little bit of lucency that's subchondral associated with that defect. And then there is also this subchondral increased bone opacity or sclerosis surrounding that defect in that caudal aspect of the humeral head. This image has a little bit of motion blur, which is why it looks kind of fuzzy. And then this patient does not have any secondary degenerative joint disease. The osseous cyst-like lesions are a little bit different in appearance and also in location, as we saw. Our example horse here is actually an osseous cyst-like lesion in the distal phalanx at the extensor process. And so the radiographic findings that we look for, very specifically, the first thing to identify is this solitary circular or oval lucent area that is in the subchondral bone. So again, this is the extensor process, and we have this oval lucency. It's not very large, so it's not really standing out very well. Oftentimes we'll see some surrounding sclerosis or that increased bone opacity. Sometimes it is a little bit thicker rim, sometimes it's a little bit thinner rim. And then sometimes when they are close to the joint, we can actually see a little channel like this patient has, a little lucency that actually goes out to the actual articular surface. And so that would be a little communication or channel to the distal interphalangeal joint. And then again, these can lead to secondary osteoarthritis. This is again just that same lesion without the arrows on it and then with some shading. Certainly more explanation and some additional examples can be found in the textbook chapters listed here in these two textbooks. And then we're going to come back and we're going to look at more specific findings in each of the joints in the dog and the horse.